Face and Parotid Region. Grand Dissector, 14th edition, pages 201 to 208, and 15th edition, 221 through 228. Here are the objectives for today's lab. We're going to start off with describing the location of the parotid salivary gland posterior and deep to the ramus of the mandible within the parotid fossa. Then we're going to have to identify the three main neurovascular structures that we can see traversing the gland. These would be the facial nerve, the retromandibular vein, which we may have already seen, and the external carotid artery. Then we're going to identify the branches of the facial nerve. There are going to be 5 main branches that we're going to try to identify. There's also a mnemonic for this. And we are then going to identify some of the muscles of facial expression that most of all actually act on the oral opening. Then we're going to trace the course of the facial artery and the facial vein in the face. Then we want to have a look at the cutaneous branches of the trigeminal nerve, so cranial nerve number 5. These are called V1, V2, and V3, or ophthalmic, maxillary, and mandibular division. And then last but not least, we want to summarize the function of the lacrimal gland, its innervation, and the flow of tears. We might just actually have a look at this very briefly because we're going to have a look at it in detail when we deal with the orbit. When we do our skin incisions for today's dissection, we have to be aware that the skin in the face is very, very thin. It's also firmly attached to the cartilage that you're going to find in the region of the nose and the ears. But over other parts of the face it's pretty mobile because we have to be able to move these parts of our face with the muscles of facial expression. Okay, and so the muscles of facial expression are going to be superficially attached to the skin, but deeply they will be attached to the skull. Okay, and as you can imagine, they will act either as sphincters, like around the mouth, but also as dilators for the openings of the eyes or for the nostrils. So after you've made your skin incisions as described on page 222 and on the previous slide, you're going to skin beginning at the midline, first removing the skin from the forehead. From this region, you're going to see that there's some pretty tough subcutaneous tissue there. Also the so-called frontalis muscle, which attaches via the epicranial aponeurosis to the occipitalis muscle. Leave this muscle intact. Okay. Then you can remove the skin from the lower face as well. Down here, again, you begin in the midline and you proceed to the left and right. You can see that the fascia of the face is pretty thick, and it also contains the muscles of facial expression. Again, be careful here, as I've mentioned, because the muscles can be pretty close to the surface and you might actually accidentally remove them or part of them, especially around the opening of the mouth. You might actually see that part of your platysma muscle, which you have reflected in one of the first labs that we've had, will extend into the face along the inferior border of the mandible. Okay, so recall that the inferior attachment of this muscle, which is also, of course, a muscle of facial expression, is the superficial fascia of the upper thorax, and it forms this kind of sheet, which when you tense your neck or tense your neck muscles, you can actually see standing out pretty strongly. Okay, then let's see if we can find the parotid duct. The parotid duct is probably approximately the diameter of your probe handle. It is not very different in color, though, to the tissue that you're going to be finding coming out of the parotid sheath. So best is if you try and find it by blunt dissecting, because you can identify the lateral surface of your masseter muscle. This is one of your main chewing muscles to close the mouth, basically. Okay, so it's just a few centimeters inferior to the zygomatic arch, and then you should see it coursing across the face all the way to the anterior border of the masseter muscle, and then it's going to dive down into this muscle here, which is called the buccinator muscle. So once you've identified your parotid duct, you can follow it posteriorly just to the anterior margin of your parotid gland here. Okay. One of the things that makes this dissection a little tricky and challenging is because the parotid gland is enclosed with a structure called the parotid sheath. Yeah, the parotid sheath and the stroma of the parotid gland are both continuous with the investing layer of the deep cervical fascia. Okay, so this is all really tough tissue, and it won't yield to blunt dissection, so you're going to have to use a sharp dissection here, either with the edge of your scalpel or with the help of your little dissecting scissors. If we have a look at this additional image here, we can preview some of the nerves or some of the branches of the facial nerve that we're going to try to find. You're going to have temporal branches going to the temporal region. You're going to have zygomatic branches splaying out over the zygomatic arch. You're going to have buccal branches towards the buccal region, the buccinator, and you're going to have mandibular branches, and then last but not least you're going to have cervical branches. One thing that can help with the identification, if we have a look at this cadaveric image here, is that the buccal branches are going to be coursing parallel to the parotid duct. So once you've positively identified one of the branches of the facial nerve, you just follow that back to the gland. You can also use that as a dissection plane. You can create a dissection plane between this, because you know anything that's superficial to it you can remove, that'll be part of the gland. And all of the different branches of the facial nerve are going to have a common root, which is going to be the common root of the facial nerve that's coming out of its stylomastoid foramen in the skull. So as you follow your branches of the facial nerve back into the parotid gland, you'll be able to remove it piece by piece, and so then you will come to see this structure, which is actually called the parotid plexus. And if you keep following these, just posteriorly, they will combine into one or two nerves just anterior to the earlobe. Anteriorly here, don't forget about your little curly facial artery. You should still see that crossing over the inferior border of the mandible. And one important thing here is the facial vein. You should still be able to appreciate this here coursing superficial to the facial artery. Here again you can see the facial artery nicely, and then the facial vein slightly posterior and superficial to it, and of course the branches of the facial nerve. If you define the anterior border of your masseter muscle, you should also be able to find your fat pad, the buccal fat pad, without any problems here, and then you should definitely use blunt dissection to remove all of this buccal fat pad, because then deep to this you'll be able to expose your buccinator muscle. Okay, and verify also that your parotid duct, that's coming from the parotid gland of course, pierces the buccinator muscle. Also, you should observe that there are two nerves that enter the buccinator muscle. Okay. As I've already mentioned, there's the buccal branch of the facial nerve that actually just crosses over it, okay, and that'll then provide the motor innervation to the buccinator muscle. But then there's also, and it's not in this picture, the buccal nerve, which is a sensory branch of the mandibular division of the trigeminal nerve. If you follow the facial artery superiorly, you should actually be able to see that it'll give rise to two additional arteries. One of them would be the inferior labial artery and the superior labial artery, and as the names imply, these will supply the lower or the upper lip respectively. If you continue tracing your facial artery up here, up the lateral side of the nose, it'll actually change its name into the angular artery. The facial vein, although it's not in this picture, it receives tributaries that are corresponding to all the branches of the facial artery. There's one thing that is clinically interesting. The angular vein will have communications with the ophthalmic veins, which are clinically important. There are several muscles around the orbital and the oral openings that we have to be able to identify. Let's start off with the muscles around the orbital opening. These are only about 1 to 2 millimeters thick, so they're very, very thin, so be careful when you skin this region here. This muscle is called the orbicularis oculi. If you look closely, it actually has two parts. It has an orbital part, which surrounds all of the orbital margin. This is responsible for the tight closing of the eyelid. And then there's this part which is called the palpebral part. The palpebral part is even thinner, and that is contained within the eyelids, and this is responsible for the blinking of the eyelid. And then you have several muscles that will act on the opening of the mouth. There's the levator labii superioris, which is this muscle here. This muscle, as the name indicates, will elevate the upper lip. Then there is the zygomaticus major muscle. This is quite easy to identify in lab. This will draw the angle of the mouth superiorly and posteriorly. Then there's the muscle surrounding all of the mouth, which is called the orbicularis oris muscle. This will pass both superior and inferior to the oral opening, and it has medial attachments to the maxilla and mandible, and the skin in the median plane, and a lateral attachment of the angle of the mouth. This muscle is basically the sphincter of the mouth that'll allow you to close the mouth and also to deform the mouth in many different ways. And then you have your buccinator muscle, which will help you compress the cheek against the molar teeth. It'll keep food on the occlusal surfaces during chewing. And then you have the depressors of the angle of the mouth. So these are called the depressor anguli oris muscles. For the sensation of the face, we have three different branches of the trigeminal nerve. As previously indicated, these would be V1 ophthalmic, V2 maxillary, and V3 mandibular divisions. The first division, or the first nerve, which would actually be the supraorbital nerve, we will study when we pay attention to the scalp that comes through the supraorbital foramen. Then you have the infraorbital nerve that comes through the infraorbital foramen. Actually, it does that together with the infraorbital artery and vein. And then down here, last but not least, is the mental nerve that comes through the mental foramen together with the mental artery and vein. It is important to know the boundaries of the distributions of these nerves, and you can find them described in writing in your dissector and in the textbook. In the dissector, it's page 225, and of course also this image here, which is from page 225 in the 15th edition of your dissector. Now turning our attention to the parotid region, as you can see in your dissector, first what we're going to do is we're going to review the branches of the facial nerve, and then going to follow them posteriorly to where they're coming out of the stylomastoid foramen. Okay, remove more parotid tissue as you do that. Then you're going to cut it really close to where it actually exits through the stylomastoid foramen and pull it forwards anteriorly so that you can still see how it branches. Okay, they're going to see if you can follow the retromandibular vein superiorly through the parotid gland as we remove more and more of the parotid tissue, and then you will have a look at the external carotid artery and follow it upwards or superiorly again as you're removing more parotid tissue. And then finally you're going to clean up remnants of the parotid gland. Take a moment and actually take a skull in lab and make sure that you can identify the skeleton of the parotid region. As you can see, the bolded terms in the dissector, you have your temporal bone, and with all of the additional features that are on the temporal bone, you should know all of these, and you should also know the mandible and all of the features and prominent landmarks on the mandible. With help of the skull and an illustration or two, you should be able to identify and define the boundaries of the parotid bed. The posterior boundary is the mastoid process and the posterior belly of the digastric muscle. The anterior boundary is the medial pterygoid muscle, the ramus of the mandible, and the masseter muscle. And the medial boundary is the styloid process and the associated muscles. And the posterior superior boundary will be the floor of the external acoustic meatus. Have a look in this cross section down here in B. It's actually quite interesting to see the mastoid process here. You can see your posterior belly, the digastric, is the stylohyoid, which comes from the styloid process. And now you're looking again at your carotid sheath, and where here you actually have your internal carotid artery. Here's your external carotid artery, because at this point they've already split. Then traveling within the carotid sheath is your vagus nerve and your internal jugular vein. It may be easier to remove the parotid gland and follow the facial nerve if you just use the tip of your scalpel blade, like you would otherwise use your probe. And if you follow it posteriorly, you should be able to see where it emerges from the stylomastoid foramen, because it's a hole between the mastoid process and the styloid process. When you're in this region, you should actually also find a nerve that supplies the ear and the temporal region. This is why it's called the auriculotemporal nerve. This is a branch of the mandibular division of the trigeminal nerve, V3. It'll actually pass right in between the head of the mandible and the external acoustic meatus, so you have to get all the way down to the bone to be able to find it, and on its way it'll cross the zygomatic process. If you haven't removed all of your external jugular vein, then you should be able to follow it superiorly and be able to find the place where it's actually formed by the joining of the posterior auricular vein and the retromandibular vein. Okay? If you then use blunt dissection and follow the retromandibular vein superiorly a little higher up, you should be able to find where it actually enters the parotid gland. If you switch to the dissection with the scalpel and you keep following your retromandibular vein through the gland, you should be able to find where the retromandibular vein is actually made up of the union of the maxillary vein and the superficial temporal vein, which is right here. See, the superficial temporal vein parallels the superficial temporal artery, and the maxillary vein parallels the maxillary artery. Should be pretty easy again to find your superficial temporal artery. See, the superficial temporal artery and the maxillary artery, these are the terminal branches of your external carotid artery. Look carefully where your superficial temporal artery is on the side of the skull here, because this is where it's actually going to be superficial and anterior to the auriculotemporal nerve. Here are a couple of links for you. If you are looking at the PowerPoint version of this, you will be able to just click on the respective image. Here's a video from the video library from the University of Wisconsin School of Medicine, and here is a link to the manual or the lab manual for the parotid gland in the face from Michigan, and here is a link to the lab video also from the University of Michigan.